The situation really concerning in Brazil, and we've covered that a lot here on the program. It just cannot get its outbreak under control. COVID-19 cases heading in the wrong direction again, and more lives are being lost. CNN's Shasta Darlington reports.
For the sixth straight month in Rio de Janeiro, more people are dying than are being born as hospitals burst at the seams. In at least 10 other Brazilian cities, the trend is the same as a crisis plays out across the nation. A surge in coronavirus seems to be spiraling out of control, killing 3 people each minute in a record high last week. Overwhelmed cemeteries resorting to late-night burials just to keep up with demand. Still, experts warn the pandemic may only get worse. A COVID P1 variant first discovered in Brazil may be dangerously mutating, scientists say, becoming more resistant to vaccines as it spreads unchecked across the country. If Brazil doesn't contain the variant, it could lead to an unimaginable loss of lives, writes a team of experts in a report published Wednesday in the journal Science. The federal response has been a dangerous combination of inaction and wrongdoing, they add, pointing to the government of President Jair Bolsonaro for its handling of the pandemic, as criticism mounts worldwide.
I have to be very clear on this. The Brazilian authorities' negligence is costing lives.
Members of the medical NGO Médecins Sans Frontières say Brazil's COVID-19 response has plunged the country into a humanitarian crisis that they warn is only likely to intensify. But Brazil's far-right leader is bristling at international alarm as he doubles down on opposing lockdown measures.
I
think I'm the only world leader taking all this criticism. It would be easier to just follow the masses. That way people don't accuse you of genocide just because I think differently.
Bolsonaro has also lambasted a probe by the country's Senate into his handling of COVID-19 and continues deflecting criticism for a sputtering vaccine rollout. So far, only about 3% of the population is fully vaccinated after political infighting and repeated delays. Meanwhile, medical systems across the country begin to collapse as worrying trends emerge.
In the first wave, we saw mainly older people. But this is not what we're seeing now. It is a disease that has shown itself to be more aggressive, particularly in young people.
A recent report out of Brazil says most ICU patients are 40 years old and younger for the first time since the country's outbreak began. No one is safe, it seems, from the grip of a deadly pandemic as Brazil's grueling battle with coronavirus rages on. Shasta Darlington, CNN, Sao Paulo.
Dr. Miguel Nicolelis is with me now from Sao Paulo in Brazil. He's a professor of neurobiology at Duke University. Doctor, good to see you again. Let's start with this. Initially, it was believed babies and young children weren't severely impacted by COVID, but official numbers in Brazil say that between February of 2020 and March of 2021, COVID killed at least 850 of Brazil's children up to the age of 9 and 500 babies, and there's been other research that says it could be twice that. What do these numbers suggest to you?
Well, this has been reported down here in Brazil, and it's very scary to see the numbers because these are, 10 times more than the United States and about 20 times more than UK. And we are seeing since the beginning of the year that the neonatal ICUs are getting crowded in several parts of Brazil. So this corresponds to the reality of what is going on down here, where you see more pregnant women being infected and more babies being born already infected by the coronavirus.
Worrying numbers. I mean, also for the first time since the start of the pandemic, the majority of COVID patients in ICUs across Brazil are younger than 40 years old. That's according to a new report by the Brazilian Association of Intensive Medicine. And also the mortality rate among patients aged 18 to 45 has soared. What does that tell you?
Well, things are getting worse for sure, and we have some studies here suggesting that even in Sao Paulo, where you get the best possible healthcare in Brazil, 7 out of 10 patients that get intubated at the ICU will die. This is, 70% mortality rate for patients who get intubated, which, I never heard in my entire career. And other parts of Brazil, in the northeast, some states in the north, in the Amazon region, that number is 9 out of 10, which is, you don't even know how to understand that.
That is incredible. I mean, for months in Brazil, deaths sat at around, I don't know, it was around 1,000 a day. And then literally in a matter of weeks, it was 2,000, then 3,000, now more than 4,000. Is this a warning for the world?
Oh, absolutely. Things are getting out of control. And I actually believe that last week we had at least one day in which Brazil reached 5,000 deaths, because one of the major states in Brazil did not report fully the data they got. They reported less than a fifth of the real data. So since they got the other day, the day after, 500 deaths in that state, we probably crossed close to 4,900 deaths in Brazil at that point. So that shows you how fast things are getting out of control down here. And that shows that the pandemic in Brazil is probably generating a lot of mutations and variants that could spread out of the country.
Yeah. What happens in one country can impact the rest of the world. I wanted to read a couple of things from, there was a team from the Harvard Chan School of Public Health and experts at the University of Sao Paulo and elsewhere. There was a study or a report in the journal Science, and I just quote a little bit from it. It said, in Brazil, the federal response has been a dangerous combination of inaction and wrongdoing. In Rio de Janeiro, political chaos compromised a prompt and effective response. It also says the COVID response in Brazil was neither prompt nor equitable. It still isn't, and Brazil is currently facing the worst moment of the pandemic. And what does all of that say about the COVID response in Brazil where you are, the leadership?
Well, basically, the Brazilian leadership, I mean, the federal government never took this seriously since the beginning. And he found all sorts of excuses not to act properly. And when we had this warning in January saying that Brazil would get into the worst part of the pandemic in 2 or 3 months, all the epidemiologists and the scientific community in Brazil started recommending a national lockdown to prevent what is happening right now. And the federal government didn't listen to any of us. So it's pretty clear that they never acted up to the task that they had in front of them to prevent this tragedy that is happening in Brazil, is unfolding at levels that we never imagined could be possible down here.
It is incredible. It just gets worse and worse every time I speak with you. Dr. Miguel Nicolelis in Sao Paulo, really appreciate your time and your work.
Thank you. Thank you very much.